All right, so we are live right now.
Okay.
And nobody has joined us yet, so we're just going to wait a few moments as some folks join us. And I'm so happy that you were able to join us today, Dr. Kinard. I think this is going to be a really great session.
I'm excited about it too, and I'm looking forward to some direct interaction with patients or whomever has residual questions almost 1 year from the law being passed, actually more than a year, but not quite a year since we were able to actually start certifying patients for this. So,
wow, so it's really great timing too.
Yes, I think it's good timing.
Fantastic. And I see some people are joining. So for those who are coming, welcome. We're excited to have you here. We're going to get started in just a few minutes as more people start to join. And we're excited that you're here.
I don't have that many friends on Facebook, but I did send an invite to all of them. So we'll find out exactly how many I really have.
You're more of a presence within your community than online.
Yeah, I know good and well that many of them are not working anyway, so they need to be joining.
Fantastic. Yeah, and those who are able to catch a little late lunch break, I think this is a good window of opportunity as well to learn something about medical marijuana.
Sure.
Fantastic. And then for those who are joining, we have some questions that were already submitted prior to, but feel free if you are really short on time or really want to get to your question fast, you can go ahead and start putting some comments in the chat and we'll make sure to get to them as we cover our live Q&A today. Fantastic. Well, it looks like we have a good amount of people who have joined us, so I'm going to go ahead and get started. And hello, everybody. Thank you for joining this live Q&A. My name is Brittany, and today I have Dr. Kinard with us. Dr. Kinard is the president at Pause Pain and Wellness, and he is also a practicing physician in Mississippi. Say hello, Dr. Kinard.
Hello.
Would you mind giving us a little brief background about, why you started Pause the Pain and kind of your history as a physician?
Yeah, sure. So I've been a practicing pain medicine physician treating chronic pain in North Mississippi for about 15 years since completing my training at University Medical Center in Jackson. And in that career, despite all of the tools that I learned to treat chronic pain, which includes a lot of what we call interventional procedures, just procedure-based injections, ablations, steroid injections, and a host of medications, including opioids. I still had far too many patients to admit that just didn't respond to what we had to offer. And along the way, I get the feedback from them about topical CBD products or even cannabis when it was technically illegal, and it still is, but we have a law now that protects you if you have a card. So I've known the therapeutic benefits of cannabis for quite some time, just hadn't been able to publicly, announce that or support it. So when the law was passed, it gave us the freedom to then incorporate it into a medical context to use to help patients. And so I was able to offer it to a group of people that would have never considered acquiring cannabis from another source or another state, even though they were suffering. And so I decided to really commit to it because I have read the literature and the research, and it's satisfactory enough to me to really make it a dedicated effort. And so I actually thought opening clinics around the state would give access to more patients, and decided to do that with some partners.
Beautiful. Thank you so much for sharing that, Dr. Kinard. Well, without further ado, let's dive into some of these questions. We've been getting a lot of screen questions coming through some emails. And, during this session, feel free to engage, ask your own questions in the comment below. This is for you, so you can learn more about medical marijuana and its benefits. And today, we're just going to go over an introduction to medical marijuana in Mississippi. So without further ado, our first question is, what is medical marijuana? So we'll start out with the basic one first.
Okay. So medical marijuana is a designation towards a plant-based medicine that has actually been in use for not just tens of years. By the state of California was the first in the United States to recognize medical cannabis in 1996, but thousands of years ago, there are recorded uses of cannabis for medicinal purposes. Mm-hmm. And so it's, again, not one of these new drugs, but it has not gone through the FDA and through the process of really stringent research, because it's been classified as a Schedule I, illicit drug. And you can't study that category of drug in humans. So that's made study and investigation very difficult, and it remains today. So the basis that we have to call it medical is through mostly anecdotal and past experience, and there's a lot of that.
Mm-hmm. Absolutely. I think it's good for people to know that history. Now, that being said, who is eligible for medical marijuana in Mississippi?
The law that was passed last February designates about 25 different specific conditions. One of them is not so specific and really applies to my whole career, and it's just chronic pain. So that really covers a broad blanket of other conditions that mm-hmm. cause pain. So it's one of the things that I've had to educate people on. There is a list of those conditions, but many of them, like epilepsy, seizures, Huntington's disease, Parkinson's disease, Alzheimer's, dementia, and cancer, the average member of the population is those are very specific, is not going to qualify based on those. But if you look a little further, chronic pain is a part of pretty much all of the specific conditions that are listed. So anything from migraine to lupus to peripheral neuropathy to osteoarthritis in any joint, back pain, disc pain, post-surgical pain of any type, abdominal pelvic pain in patients with interstitial cystitis, all of these things. And so Crohn's disease is mentioned, but chronic nausea and vomiting and abdominal pain are part of Crohn's. You do not have to have Crohn's to have those others, and those would still qualify you. So there is a list, but what we encourage our patients to do that call and inquire, am I a patient? Mm-hmm. We ask them to please just go ahead and schedule the appointment and have the consult. If you're not certifiable, you don't pay. It's your time and your effort to come and find out. But we'd rather not a website or someone answering the phone try to determine that. We have professionals in place that we pay to have that interview with you in that evaluation.
Mm-hmm. Awesome. Well, you just kind of knocked a couple birds out with that stone there.
Yeah.
And I know some of the other questions were asking for very, specific qualifying conditions, which I know you listed there some. But if people were curious, if they did qualify, is there a place where, they can look up and kind of make some of those precursors for themselves before they make an appointment?
Sure. Our website has the complete list. That's pausthepain.com. And then you have the Mississippi State Department of Health. You have website advocacy, third-party websites like the Mississippi Cannabis Patient Alliance, MCPA, and 3MA, which is Mississippi Medical Marijuana Association. those are going to have a lot of answers to frequently asked questions and a list of the diagnoses as well.
Fantastic. And for those who didn't catch the first website, there down the bottom, pausethepain.com, you can find a list of those conditions. Now, I know you loosely covered it, and one of the questions is, how can I apply for a medical marijuana card in Mississippi?
Yeah, there is a process, and it needs to be followed, and it's explained on any of those sites as well as the conditions. But you need to do a little work to ensure first that you meet some of the criteria, even if it's just softly. And if you're not sure, we like I said, really encourage you to go ahead and schedule the appointment and get the details. Mm-hmm. Maybe you're not eligible now because you need to acquire some more records for us to ensure that you are eligible. There's no way to know that over a quick phone conversation. So there is a process, an application process, though, outside of the evaluation. If you come to see us and we determine that you are in fact a candidate, in our opinion, we will complete an application on your behalf, and you will be required to complete one to the Department of Health as well. It's not too arduous, but we are there to help you, guide you through that, entering that application if you need help while you're there or later. And you also need a photo ID, a photo for an ID. And we actually take that at our clinics as well against a white backdrop according to the Department of Health specifications, so that you don't have to go acquire that separately. At that point, after we determine that and we each submit that application, there's a brief waiting period for you to achieve a report back from the Department of Health and get your digital card. So it will not be an actual tangible paper or plastic card. It will just be an emailed document that you could print or show with your phone. It's going to have a QR code on it, and it's going to be attached to our provider and legitimized through that digital format from the Department of Health. You then take that to the dispensary to purchase the product, and then you will have a scheduled follow-up with us to manage.
Awesome. That was very insightful. Now, I'm sure it's different on case-by-case basis, but do you have an estimated timeline from the moment they walk through your doors to the moment that they get the product? If
yes.
They're eligible, that is, of course.
Yeah, and thankfully, that timeline has gotten smaller and smaller over the months as the Department of Health has had a chance to kind of catch up to speed and catch their breath with applications from the industry side, which they also are responsible for. They have partnered with other companies to facilitate turning around these application process. So it used to be up to and sometimes beyond 30 days, and now it's typically less than 2 or 3 days that they receive your application that you actually get your card.
That's incredible.
Yes.
Awesome. Well, moving on to some more facts about, medical marijuana, and that is, what forms of medical marijuana are available in Mississippi?
That is an excellent question, and I don't give short answers, so it's really you're gonna have to stop me, and that's a good thing because that means there's not just one, and the one that most inexperienced patients, because I'm referring to them as patients because we are talking about medical cannabis. So the first thing to realize for medical patients is that the goals of a recreational user, no offense to them, is not about whether you want to be one or whether you are. Nothing in my mindset about this has to do with anything but separating the goals of each of those people. If your goal as a recreational user is wholly different than your goal as a medical patient. The medical patient wants relief from pain, from nausea, from spasticity, muscle spasm, from insomnia, not being able to sleep because of their symptoms. They're after there's a medical goal there. So the formulations that are available now would blow your mind. because the concern over, well, I'm going to have to smoke a joint to get this that you're telling me and everybody knows is medicinal. I'm going to have to smoke that to get that benefit. I still can't get there. Like mentally, I can't make that leap. And that is not true. So the industry of medical marijuana is very sophisticated. And so the formulations range from, yes, smokable flower. Okay, the flower bud on the plant is what is dried and has the chemical composition that provides benefits for recreational users and medical. Just that little flower. The rest of the plant can be used to make rope and textiles and all kinds of things, and that's referred to as hemp. But medical marijuana is the flower, and extracting serum and oils and things and combining it into oils is how you make it into different formulations besides smoking. So you have, everybody is clearly aware of edibles now and gummies. I mean, not everybody, but most people are. And so that's one way, an ingestible form. And you also have topicals, so creams and gels and things that you can apply to the skin. You have capsules, so they can take the active ingredient and put it in a powderized form and include it in a capsule like you would any other medication. And also they have droppers or tinctures that you simply take a dropper like you would a pediatric dose of any other medicine for a child, and you drop it under your tongue and you hold it in your mouth and let it absorb that way. So there's multiple forms, and there are several that we recommend based on your experience level. And so that's why a medical visit and a medical follow-up are important, because what I just told you, I learned in the last year. So, physicians and other practitioners are not taught this in medical school. This is something I've had to kind of really reach out to colleagues, read books, and look at the research and separate my mindset that I'm using this as a medicinal treatment for a patient, not a recreational user, which almost exclusively want dried flower to smoke. So the other end of the spectrum for medical is multiple formulations based on what your comfort level is and what your goal of treatment is. Told you I gave you a long answer.
Yeah, I think it seems super sophisticated, and we've come such a long way with medical marijuana. Now, you talked about all of these different formulations and ways that you can intake the medical marijuana. How does the user know which type is right from them?
Yeah, well, that is going to be a decision that likely, if they don't have experience, will need to be made with their practitioner.
Mm-hmm.
And that is why I am proud that Mississippi made this something that you have to be in person, face to face, and discuss. So you cannot achieve this through telemedicine, this initial visit at least. And then the follow-up visits can be offered through a telemedicine platform. But this is a big decision for a patient. They're entering a new space, and they need to know about what other medications they're on that could interact, just like you would if you prescribe any other medication. You need to know what your goals are as a patient, and then, our practitioner will help guide you on the dose, the formulation, the frequency, and the route that you take it.
Beautiful. Yeah, I love that it's so, hands-on, and really the goal is to find that relief of pain that the client is experiencing as well.
Yes.
Fantastic. Yeah. Now, the next question that we have is, I know that it's legal in Mississippi, but can you use it anywhere in Mississippi? Are there rules and regulations still?
Yes. So your card does protect you in obvious ways, because you're now abiding by the law by possessing a maximum amount, and we could get into the specifics of that, but it's listed. But it doesn't exclude you from other responsibilities, and it specifically mentions that it should not be ingested or used in a public space. And that would really include your car. So I want to caution patients that, and we do, that, obviously if it's a capsule or a gummy preparation, there's not going to be any noxious smell or anything that someone would even know you're doing it. Really probably referring as much or more to the inhalation forms. Cannot be done in public. They recommend that you do those in a private space. And so that is an important point to make.
Yeah, absolutely.
And you can't cross state lines with it either, technically by the law. So interstate commerce laws for controlled substances, this one's still classified as a Schedule 1 by the DEA of the United States government. So in that case, if you take your medical cannabis across state lines, you are violating that. And so how much they enforce that, I think it's enforced minimally, but it's not for me to say. You wouldn't be the one that they started the enforcement with. So we also caution our patients not to travel with it, if at all possible, and just be careful. And that kind of bleeds into maybe another one of your questions about safety and protection of your medication, like you would with any other medication, especially one that could potentially have psychoactive properties. You want to protect that from pets and small children. So you probably want to put that in a cabinet that's unreachable or lock it and treat it with respect. Just, outside of the being able to use it in public, you want to make sure it's not sitting out where someone that's not a medical patient could have access to it.
Yeah, absolutely. It's very important to note because accidents do happen. So make sure to protect it at all costs.
Yes.
You made a good point about crossing the borders into other states and territories. Now, say you have your medical marijuana card in Mississippi. Could you go to another state where it's legal and still purchase medical marijuana in the other state with your Mississippi card? Or do you need it on state by state basis? Say you are traveling and you cannot take your medication with you, but you need that for your pain relief. Can you still get that in another area?
Yeah, so there's a practical answer and a technical answer. And the practical one is many people are getting this in before our law was passed from other states and bringing it into Mississippi. Technically, that is a violation of federal law. So even if you have a card and you go to Arkansas, who has a medical program, and you purchase it there and they allow it, because it would be that state's acceptance of your Mississippi card was all that would matter. But you're coming back to Mississippi with it, therefore you're crossing that state line with marijuana. So just because they accepted your Mississippi card does not exclude you from that responsibility to not travel with it. So yes and no. Will Mississippi eventually accept other states' cards? I'm not sure. They do not currently. So there's an answer to a kind of frequently asked question. And that's the reason. There is a temporary quantity. You can register as a temporary card holder with the Department of Health. So if you're from another state and you visit Mississippi, you can have 4 weeks of use of a temporary card in Mississippi if you're authorized in another state. So all you have to do is meet the other state's requirements and proposition the Department of Health for a temporary card so that it's a continuation of care situation, so that you have your medication and you didn't have to cross state lines with it.
That's very helpful. I'm sure there's a lot of folks that travel to visit family, friends, even around the holidays. So I think that is really great information.
Right. You would want to get ahead of that now. So don't wait 2 days before your Christmas vacation to see your family in another state to make that request of the Department of Health, because you're probably not going to be able to turn it around quite that quickly. So.
It's great to note for those who are watching. Now, I know we talked about all of the benefits of medical marijuana, but are there any side effects that people need to be aware of?
Sure. Any medication that we have in the history of medicine that's had enough of a positive benefit also has a risk profile. I mean, almost exclusively. So even aspirin over the counter has a warning that caution with use if you have, cardiovascular disease or stomach ulcers. There is no magic pill or treatment that has all positive benefits, no negative ones. So clearly, some of the common ones are dizziness and somnolence and just kind of being heady because you got a little bit too much. That is the most common side effect. The good news is most of the adverse side effects, like dry mouth, sleepiness, somnolence, dizziness, these usually resolve on their own without further treatment. And that's the good news. And so what you would do is if you had a situation where any of those formulations, or maybe you were trying to switch from one to another and it affected you differently, in a matter of a few hours, you can note that, log that in your memory and go back to a lower dose or a different formulation next time. So, I mentioned the common side effects. The good news on long-term side effects, because this is a big question. What about dementia, memory loss, long-term? In my review of the data, most of the short-term memory deficit experienced by usually chronic heavy users. So we're really not talking about doses that are common for a medical patient even, but even in the recreational chronic heavy younger users, any memory issue resolves after they stop use. So we don't have any evidence really that cannabis, whether you're taking a normal dose or a high dose, has long-term negative side effects of almost any sort.
That's beautiful. It sounds like very little risk involved. And if anything, just kind of change the strain that you are currently using, which leads me into my next question. And I just want to pause for a second and let everybody know we have about 5 more minutes. So we're going to, take in some more questions, and we have time for 1 or 2 more, depending on how detailed it is. So go ahead and put your comments below. But the next question that kind of leads into that segue is, which strain should they try? People, they get a little bit overwhelmed whenever they're visiting the dispensaries or looking online, and you have sativa, indica, hybrid. How do they know which one they should try, and what are the differences between them?
A great question, and very important. And it's a major source of hesitation for patients to even come, have an evaluation with us or entertain the idea of using it. Most people now have heard enough positive about a medical cannabis program, and the fact that Mississippi was the 37th state to incorporate one. I mean, there's got to be something to it. If it's being allowed and you haven't heard too much negative, where's the positive? But once they start looking into it, it's overwhelming. So even just, yes, I've talked about formulations, but I know there's 2 different strains, and then there's a combination strain called a hybrid. How am I supposed to know? You're not supposed to know. We've never had these options presented in a medical format. So our practitioners have made themselves educated on which strains are best for what condition targets. So there is no even long-winded answer from me that will explain all of that very easily. We have to know what you're after, your symptom relief that you're after. So, but to take an example, and we will guide you through this. We actually give you a patient guide when you leave from your appointment, and we have a lot of resources available on our website that you can follow up to regarding dosing and what experience level you are. So indica is typically a more sedating hybrid or chemovar that it's referred to. Sativa tends to not be as sedating. So you would really do need to know that. If you're trying to take it at night for pain or insomnia or anxiousness, the indica is probably the more sensible one than the sativa during the day. Maybe you are adjusted after several months to where you can take a hybrid both times. That's something that you'll determine yourself, but you really need to start out in a way that gives you the best chance to succeed. And it's difficult, and we agree. So we know we need to help you through that.
Awesome. Thank you so much for that short answer. I know that it can, kind of snowball really quickly with the different strains, and we have some more live Q&As lined up for you guys so we can dive deeper into some of these topics. But we have ran out of time today, and I just wanted to encourage you all, if you have more additional questions, you can always reach out to us at our website, pausethepain.com, and Dr. Kinard is more than happy to answer some questions if you leave them in the comments below, and I can funnel them to him, and we can still answer your questions if you missed this live broadcast. Do you have anything else that you would like to let the people know, Dr. Kinard?
No, I appreciate their interest. I hope it grows. And my responsibility as the president of this company is to make sure we inform and educate and provide a valuable service. So these kind of things, and thank you for emceeing this and coordinating and helping guide us through it very nicely. I enjoyed it.
Absolutely. And just so everybody's aware, we do have another one planned for you next week. Same time next Thursday. So we hope to see you there as we keep diving into this topic of medical marijuana. Have a great day, guys, and we'll see you soon.
Thank you.